Evara Health has won a $2 million grant to help improve the lives of mothers and babies across the Tampa Bay area, and I'm grateful to them. They are at the forefront of working together to make sure that moms and babies, especially in the heart of South St. Pete, they get the care that they need so that there are good outcomes, that children have every opportunity to thrive, and that their mothers are healthy and well.
Every day, thousands of babies are born across the country. Unfortunately, not all of those babies and moms enter what we call the perinatal period, so the period of sort of being pregnant, before being pregnant, delivering, and afterwards, which is called postpartum. Not all of those people enter it with the same chances of having a positive outcome, unfortunately. What we see now in the United States is that the rate for death, for mortality, for moms, for pregnant moms, continues to be quite high, higher than any other high-income country in the world. Actually, we have the highest rate, which is unfortunate given our very extensive and vast healthcare system. What are some of the reasons for that disparity, right? We all live here, we all have our communities. Many of us have access to hospitals, many of us do not in rural areas. And so what's the reason for some of the disparities that we see? Well, we have to go back and sort of look at our social determinants of health. We have to look at, unfortunately, and factor in possibly racism as some of the cause of that, and how the system is built to treat or not treat people. We would like everyone to have the same opportunity to be healthy, and so by saying that means that everybody has access to care. We would love to see reproductive care available to every woman before, during, and after pregnancy. We would like to see care available for all families. So let's just start there at the 30,000-foot view. And then let's go a little more specific. We'd love to see more providers. And so by that, I don't just mean doctors and nurses, such as myself. We need more community providers, community birth workers, community perinatal experts, and we have them. We have them in midwives, we have them in doulas, we have them in community health workers who specialize in perinatal care. We have partners all over, so we just need to build a bigger and a stronger network. We need to learn how to train together as teams so that the care of the patient is seamless across the spectrum. And what we'd really like to see is that the reimbursement that providers receive is fair and equitable. And that's not to say that reimbursement impacts whether we're providing care or not, but we would certainly like to see our community perinatal experts being reimbursed in the same manner that you will see a physician or a nurse for the important work that they are putting in. And then last but not least, I think it's really time for us to stop and take stock of what the patients are saying. This should be a patient-centered, patient-driven effort. We should be listening to the moms. We should be listening to the burden people. We should be listening to their partners and their families. People know their bodies, and so we need to listen, and we need to be more respectful about how we approach them in the prenatal period and how we approach them during labor.